I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Boyd, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Hemmer, Hicks of Hawkins, Hicks of Washington, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Mr. Chairman, you have a quorum.
All right, thank you. And before we get into the calendar today, do any of the members have any personal orders? All right, seeing none, let's get to our calendar. Item number 1, House Bill 275. Chair Lady Hazelwood, you have a motion and a second.
Thank you, Mr. Chairman.
And do you have an amendment? Is that correct?
I do. The
Oh.
amendment number is 005845.
Okay, do we have any objection to putting that amendment on there? Okay, seeing none, we're voting on amendment 5845. All those in favor say aye. Opposed, ayes have it. We're on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Back in 2017, this body passed legislation for a syringe services program in the state. I'm happy to tell you that passing that has resulted in saved lives in Tennessee. There's a reduced amount of transmission of HIV and hepatitis C. And one of the more amazing things about this is that folks who have been involved in this program they're 5 times more likely to enroll in treatment and rehabilitation programs. So we really are making an impact, a real impact on Tennesseans with these programs. When first passed in 2017, the prohibition was that these locations could not be out. The urban areas could be within 1,000 feet of school or park or church, but in the rural areas, it had to be 2,000 feet. That's proved to be difficulty for some of these programs to find appropriate locations, and there is a need for those. In fact, the incident number of these sorts of situations is higher in rural counties, and 41 Tennessee counties have been identified as hotspots, if you will, potential outbreak locations. So this bill would simply change it to 1,000 feet statewide. The amendment that you put on provides an exception for Kingsport because they want to use the program, but they just weren't able to find a location that they were comfortable with within that 1,000 feet. So the amendment exempts Kingsport. They're still at 2,000 feet as the original bill was. With that, Mr. Chairman, I would entertain any questions.
We have questions for the sponsor of the bill. Okay. Seeing none, we are voting on House Bill 275 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you very much.
All right, that brings us to item number 2 on our calendar. House Bill 334 by Chairman Hurt. You are recognized.
Thank you, Mr. Chairman and committee. House Bill 334.
You have a motion and a second.
Okay, sorry. House Bill 334 is regarding licensed sleep technicians. Tennessee has approximately 300 licensed sleep centers. One of those operators is from my district, which is where this bill originates. We do have a shortage of licensed sleep technicians in the state, only about 400 statewide. Once diagnosed with a sleep disorder, it can take up to 2 months in Tennessee to be treated. So how do you get to be a sleep technician? First, you need education and training. Then you must pass a test approved by the Tennessee Polysonography Professional Standards Committee, and then you must be licensed by the committee. Current law allows students to take 3 kinds of training to qualify for the exam. But members, there's a catch. The most common sleep technologist training program in the country is the program accredited by the American Academy of Sleep Medicine called ASTEP. These programs require more than 80 hours in the classroom plus field experience. ASTEP training is approved in current law, but only if other more expensive programs don't come into the state. If they do, then the A-STEP program goes away as an option. You wouldn't open a business if you had to close because your competition came to town, but that's exactly what existing law does. It's a barrier to entry that creates shortages and raises prices exactly where we are now. House Bill 334 is a very simple bill. It does one thing and one thing only. It simply says A-STEP training is appropriate regardless of what happens in the rest of the marketplace. It doesn't change the exam a sleep technician has to pass to get licensed, and it doesn't change the role of the board in licensing sleep technicians. The Polysomnography Committee is aware of this bill and has spoken positively of it in recent meetings. And with that, Mr. Chairman, I think we have someone on the list to speak in support or on the bill today.
Yes, and unless there is any objection, seeing none, let's go out of session. Okay, we have a Mr. Or Chandra, I believe. Yes, all right. If you can come on up and, yeah, sit right there, perfect. There's a little button to push to make sure that your microphone is on, and tell us, before you start your testimony, tell us who you are, who you're with, and then you'll have 3 minutes.
Sure. I'm Dr. Anuj Chandra. I'm from Chattanooga, Tennessee. I'm the medical director of Advanced Center for Sleep Disorders. I've been practicing in the Chattanooga area for almost over 27 years, and I've been doing sleep medicine for over 18 years. And I really appreciate the opportunity to be able to explain to you about this bill. And thank you, Representative Hurd. This is a really huge service that you're doing to people in Tennessee. A-STEP was accepted by Tennessee up until 2006 or 7. It's universally accepted all across the U.S. Most states that I know of, Alabama, Georgia, it's a recognized pathway to getting your certification, your licensure. It's, extensive training. Somehow, somewhere in the middle, Tennessee stopped accepting that. This has truly been, and I'm not exaggerating or being or speaking in hyperbole, it's been the death knell for sleep medicine. Tennesseans are being forced to get their care in outside states. Come October, November, people have met their ungodly $5,000 and $7,000 deductibles. Everybody's saying we know we've got sleep apnea, we've got other sleep disorders. Can you get us in? We won't be able to do this. It's an elective procedure. Once this year passes, our deductibles start off all over again. Most places have not 2 months with, Representative Hurd, but it's more like 3 months waits. So that's basically because of the sleep technologist shortage. You cannot get them into the sleep lab to do their testing. And unless you do the testing, you can't start their treatment. So this is going to really remove barriers to patient care. It'll allow patients to stay in the state and, so I think it's a great service that you're doing. It's recognized all across the country. It's a legitimate pathway which has been accepted. So, and we were offering it. I think we were one of 3 centers back in 2007 and 8. We used to offer that, and everybody passed their certification national exam. They became licensed. So it's not just that you do the A-STEP. After that, you got to work 8 and 9 months in a sleep center. Then you have to take your national boards, which is the Registered Polysomnography Technologist exam. And only then do you apply for your licensure. So by limiting this, I don't know how it happened. It just slipped through. And, and this did a huge disservice to, residents of Tennessee. I'll stop here and, I'm ready for questions.
All right, while we're out of session, do any of the members have any questions? Okay, seeing none, thank you for your testimony. Appreciate it. Very thorough, and thank you for coming with us today. Thank you.
Thank you.
So
Thank you,
without
everyone.
objection, we will go back into session. Chairman Hurt, you're recognized.
Thank you, Mr. Chair, and I appreciate our guests making the trip up. Mr. Chairman, with that, we have a chance to help more Tennesseans rest easy. I'm happy to take any questions and hopefully move this bill on.
Oh, you had me till that. All right.
Had to.
Yeah. Do we have any questions for the sponsor? Okay. Seeing none, we're going to put this bill to bed by voting on it here. Okay, we're voting on House Bill 584. Yeah, all those in favor say aye. Or excuse me. excuse me, 334, as Bill 334. All those in favor say aye. Opposed? Ayes have it. Bill moves on to calendar and rules.
Thank you, Mr. Chair and committee.
Representative Hurt, I guess you're on cloud nine now that that passed, right?
All righty. Let's get back to our calendar here. We've got, I think I jumped the gun there, but we are now on House Bill 584. Representative Gant, you are recognized. You have a motion and a second, and I believe there are two amendments. Is that correct?
I'm sorry, just one. Second was already put on as traveling with the bill.
It came from subcommittee, and so we have to put that on again.
Okay, we can do that.
So we have amendment 5191. Is there any objection to putting that on the bill? Okay, got a motion, a second. Okay, without objection, we're voting on amendment 5191. All those in favor say aye. Opposed, ayes have it. We're on the bill. We have a second amendment that is 6125. Is there, okay, you have a motion, a second on that. Is there any objection to getting that on the bill? Okay, without objection, we're voting on amendment 6125. All those in favor say aye. Aye. Opposed, ayes have it. You're back on the bill as amended.
Thank you, Mr. Chairman and committee. And this is a piece of legislation that is pertaining to McNairy County, which is in my district. And this amendment limits the conditions of the bill so that it only applies to Magnolia in Corinth, Mississippi, and the emergency room in question in Selmer, Tennessee. And the Satellite Emergency Department primary care clinic or urgent care clinic is located in that county. And these are some of the parameters that are now in the legislation that was with the amendment that we just put on. In that county, in the borders, the neighboring state and contiguous county in which the hospital is located is designated as an economically distressed or at-risk county by the Department of Economic and Community Development, as updated annually, and has a population of less than 27,000 according to the 2020 federal census or subsequent federal census. And the second amendment we put on was in conjunction with you, Chairman, and thank you for your help on this legislation. And what it is doing is it's just clarifying the physician is licensed to practice medicine in this state and is employed at the hospital in the neighboring state. So thank you for your help in making sure we were clarifying that. So with that, I'll try to answer any questions you may have.
Do we have any questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 584 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules as amended.
Thank you, committee.
All right, that brings us to item number 4, House Bill 1077. Representative Thompson, you are recognized. You have a motion and a second. And I believe, is there an amendment with this? Okay, Amendment 5042, is that what you have? Okay, if there is no objection from the body, is there? Okay, if no objection, we do have a motion on the amendment. We have a motion second on amendment 5042. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chair and committee. As amended, House Bill 1077 fixes inconsistencies in our code to allow local vendors and farmers to prepare and sample at our local farmers markets. House Bill 1077 defines a farmers market unit, farmers market food unit, and creates a farmers market food unit permit that will be issued by the Department of Health. Now, once permitted, this will allow our local vendors to again have parity in our law that will allow them to prepare and sample food at our local markets, just as they could if they were at a festival or a special event. The second thing it does is to allow vendors at farmers markets to offer samples of food for consumption without having to obtain a license or permit. And basic food safety protocols are outlined in the legislation and requires vendors to comply with all sanitary requirements. Basically, this supports our local farmers and small business owners, but also aligns our standards with our code to make this regulation more equitable and work better for our citizens. Happy to answer any questions.
Do we have any questions for the sponsor of the bill? Okay, seeing none, question has been called. We will be voting on House Bill 1077 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Chair and Committee.
All right, thank you. That brings us to item number 5, House Bill 1312 by Chairman Kumar. Chairman Kumar, you are recognized. You have a motion, and a second.
I need a motion. I need a motion.
Yeah, motion second. Yeah, he did. He gave him the motion. You are recognized. Yeah. Yeah, he did a French. Yeah. All right. Wait, do you have amendment? Is that correct?
Mr. Chairman, can I take a few minutes? This is scary.
Yeah. Yeah. No. So you have an amendment. Is that correct?
Yes, it is number 4942.
Okay. 4942. Can I get a motion? I get a motion, a second. Okay. Without objections to this rewrites the bill, let's go ahead and add that to the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bills amended. You're recognized.
Thank you, Mr. Chairman, and thank you, committee. House Bill 1312, as amended, allows that a qualified and fully trained physician who is licensed outside the United States may apply for a temporary license in Tennessee if they prove competency and they have the offer of employment from an approved residency medical institution in the United States, in the state of Tennessee. This residency must be approved by the Accreditation Council for Graduate Medical Education. Physician practicing under this temporary license will have a 2-year period during which, if they function in a satisfactory manner, they can then take the licensing exam, and after that, they will qualify for an unrestricted license. This would help the physician shortage within Tennessee. 92 of our 95 counties are listed as having a physician shortage. And with time, in the next few years, we'll have a shortage of more than 1,000 physicians within Tennessee. Again, these are qualified physicians who have proven their competency by serving in an approved medical institution as well as taken the exams. With that, Mr. Chairman, I'm ready to answer any questions.
Do we have any questions for the sponsor of the bill? Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. Are there any countries that are specifically excluded from qualifying under
No.
this? Okay, thank you.
Any further questions for the sponsor of the bill? Okay. Seeing none, we will be voting on House Bill 1312 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. Right, that brings us to item number 6, House Bill 1311. Chairman Kumar, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. House Bill 13, I do have an amendment,
Okay.
5967.
Let's see. Yes, Amendment 5967. We have a motion. Okay, we have a motion and a second. Okay, if there, and this rewrites the bill, if there's no objection, Let's put that on. Without objection, we're voting on House Bill, or excuse me, Amendment 5967. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. Chairman Kumar, you're recognized.
Thank you. House Bill 1311, as amended, addresses the situation that a medical student who has graduated from medical school, passed Step 1 and Step 2 of the United States medical licensing exam, who applies for a residency and for some reason does not match with a residency institution. The cycle is a yearly cycle. After the residency, there is a scramble for those students who did not match, but those slots are mainly for primary care. And if the graduate has planned on a specialty training, it does not suit their purpose. In Tennessee, in 2021, there were 664 medical graduates. 10% of them did not match in the residency initially. So it's about 66 medical graduates. There is, this bill creates a collaborative program under which these graduates can have a temporary license to practice under the supervision of a licensed board-certified physician in a medically needed area. This temporary license is good for 2 years, during which it is expected that going through the match cycle, they will be able to find a suitable residency. This will encourage these physicians to stay within the state of Tennessee so that they do not go out of state for programs similar to it that are offered in other states. And hopefully, as they stay here for Tennessee, we expect that they will stay in Tennessee and alleviate the physician shortage. And thank you.
Do we have any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1311 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us to item number 7, House Bill 779 by Chairlady Hilton Haynes. You are recognized.
Thank you, Mr. Chairman. Need a motion?
You have a motion and a second?
Thank you. I do have an amendment 5909.
Okay, you have a motion and a second on the amendment 5909. Without objection, let's go ahead and attach that to the bill. All those in favor of amendment 5909 say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Currently, there is no statutory time frame that requires a health licensure board to issue a license. This legislation will establish reasonable timeframes that licensure boards should either issue a license or notify the applicant that they must appear in person before the licensure board. This is a common sense approach to ensuring that our healthcare workforce is able to work as quickly as possible and that state licensing boards are not impeding addressing the workforce shortage concerns. Amendment 5909 sets a 45-day timeframe for an applicant who is transferring from another state or jurisdiction to receive their license if the applicant has submitted a completed application. Further, if the applicant must appear in person before the licensure board, then the applicant must be notified within 45 days. This provision applies to the Board of Medical Examiners, Board of Osteopathic Examination, Board of Nursing, and Board of Physician's Assistants. These boards meet every other month and therefore have a 45-day time limit. There's also one for the Board of Alcohol and Drug Abuse Counselors. They set a 60-day time frame for an applicant who is applying for their license for the first time, or an applicant who is transferring from another state or jurisdiction to receive their license if the applicant has submitted a completed application. This board meets quarterly and therefore has a 60-day time limit.
All right, and
Thank you, Mr. Chairman.
thank you. And I do believe that we wanted to get a clarification here on legal on something here. So without objection, we'll go out of session.
Thank you.
Matt King, Committee Counsel. Yeah, Chairman, it was brought to our attention shortly before this meeting because this amendment number 5909 was a combination of several other amendments that were redrafted, rolled together. It was brought to our attention that when this document is being pulled down in certain ways, which one of those is the way which we produce the amendments that have a header on them, which show what committee it came out of. And other entities such as the clerk's office pull from that same database. Some of the red line marks are still showing up for whatever reason. It's a software issue. So if the committee passes this out, what we would like to do is take the exact language of 5909, just drop it into a new draft number. So it would have a different drafting code number on it, which is why I wanted to bring it to the committee's attention so that you don't think that it's substantively any different. We would just drop it into a new number so that should that document be pulled again in the future, it's clean.
His head's spinning.
Do we have any questions while we are out of session? Okay, seeing none, we'll go back into session. Do we have any questions for the sponsor of the bill? And before we do vote, I do want to make a comment, and this was something that was brought up in subcommittee, not necessarily particularly on this bill, but this bill may have some impact on. We have another two bills in subcommittee dealing with some of our boards, and I just think it's important for our members to know that while these boards are trying to function as efficiently and as quickly as they possibly can, sometimes there are things that are out of their control, or they have no ability to have any impact on those things, whether it's other employees or the medical director or the executive director or something like that, that may impact how they can get some of these things done in a timely manner. So I think that's just important for us to remember as we go through. But I do support this piece of legislation. So without objection, let's vote on House Bill 779. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. That brings us to item number 8, Senate Joint Resolution 44 by Chair Lady Hilton Haynes. You are recognized.
Thank you, Mr. Chairman.
Do you have a motion and a second?
Thank you. Cardiovascular disease is a leading cause of death in the U.S., killing more people each year than all forms of cancer and accidents combined. SJR 44 urges state agencies to expand comprehensive cardiovascular screening programs to allow for earlier ID of patients at risk of cardiovascular events. Urges state agencies to explore ways to collaborate with federal and national agencies to establish or expand comprehensive cardiovascular screening programs. Urges an update of the state's cardiovascular plan to accelerate quality improvements in patient care. Supports the creation of policies to decrease the rising number of deaths of Americans as a result of atherosclerotic cardiovascular disease. That's all it does.
All right. Do we have any questions for the sponsor? All right. Seeing none, we are voting on Senate Joint Resolution 44. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to, or resolution goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
Thank you. And let's see, I do not see Chairman Boyd. So without objection, we're going to roll item number 9, so Senate Joint Resolution 62 to the heel. All right, that brings us to item number 10, House Bill 981.
Motion on the bill.
Chairman Faison, you are recognized on House Bill 981.
Thank you, Mr. Chair. Committee, we are reconstituting the EMS board.
All right, and I believe we have an amendment. Is that correct?
We do.
Okay, 4780.
That's the amendment I have.
Okay, you have a motion and a second on that. Without objection, let's go ahead and vote on Amendment 4780. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are
Question
back
on
on
the
the bill amendment. Are there any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 981 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations. All right, let's see what number. That brings us to item number 11. Let's see what I have here. 677. Yep. All right, that brings us to item number 11, House Bill 667. Representative Hicks. You are recognized. You have a motion and a second.
Thank you, Mr. Chairman. I also have a couple of amendments that needs to go on the bill.
All right, let me,
4805.
okay, we have amendment 4805. I need a motion. Okay, we have a motion and a second. Okay, without objection, let's vote on amendment 4805. All those in favor say aye. Aye. Opposed, ayes have it. We're back on the bill. We have a second amendment, drafting code 5053. Is that correct?
That is correct.
Okay, you have a motion and a second on that. Okay, without objection, let's go ahead and put that on there as well. All those in favor say aye. Aye. Opposed, ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. House Bill 667 amends the Tennessee Prescription Drug Donation Repository Program. It will be known as the Kevin Clausen Drug Donation Act. Prescription drug donation repository programs can accept and dispense donated prescriptions and supplies when requirements are met and are regulated by the State Board of Pharmacy. A prescription drug donation repository program is responsible for developing and implementing standards and procedures to determine that donated prescription drugs appear to be unaltered, safe, and suitable for dispensing. Every year, billions of dollars worth of medications end up in landfills. These programs allow unopened and unexpired medications to be redistributed to qualifying individuals and prevent medication waste and increase medication access to individuals in need. In an effort to align with national standards for such program, Tennessee's program has the opportunity to modernize to meet the demands and needs in the state. Areas of focus include broaden the definition of donors, redefine the income qualifiers, more specifically, the definition of indigent, and redefine eligible recipients and expand the list of acceptable medications. House Bill 667 just sort of modernizes this act and really gets donated drugs in the hands of the folks that needs it the most. And with that, I'll ask for passage of House Bill 667. Thank you.
All right. Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Colleague, just, I guess, a little clarification for me. Are there liabilities for the state or any other entity that we need to be aware of in the products being, I guess, the packaging or how it's stored, the dating on it? Are there any liabilities to anything like that?
You're recognized.
Thank you, Mr. Chairman. Not to my knowledge, there's not any repercussions for the state. This is all done through the Pharmacy Association and the pharmacies, and there's a process for everything that goes on. It's in the bill. And I think they pretty well covered everything and every liability that the state would have.
Okay.
You're recognized.
Thank you, Mr. Chairman. Just one other question. Section 6 here said donated inventory may be used to replenish purchased inventory in compliance with applicable federal law and regulations. I didn't know if that meant that these products could be put back on the shelves and be sold, I guess, in the normal manner that drugs are sold in a pharmacy.
You're recognized.
Thank you, Mr. Chairman. They cannot be sold. They can be donated to the pharmacies, but they cannot be sold at all under this program right here. Okay. They can actually, if there's not anyone to donate the drugs to, there can be a handling fee to someone that needs them. It goes down a list of indigent, then someone that really needs someone, and that has different scales of insurance, but it can never be sold.
Okay. Thank you, Mr. Chairman and Representative Hicks.
All right. Thank you. Any further questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 667 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman. Thank you, committee.
Thank you. Without objection, going to bring up a Senate Joint Resolution 62 by Chairman Boyd. You are recognized. You have a motion, a second.
Thank you, Mr. Chairman of the committee and members. If you're not familiar with hypertrophic cardiomyopathy, it is a chronic disease that involves the thickening of the heart muscle, and it can lead to the development of debilitating symptoms and serious complications. And it affects approximately somewhere between 1 in every 500 Americans to 1 in every 200 Americans. A lot of people have gone undiagnosed. And so, Mr. Chairman, what this resolution would do is it would designate February the 22nd, 2023 as Hypertrophic Cardiomyopathy Awareness Day in the state of Tennessee.
All right, thank you. Any questions for the sponsor of the bill? All right, seeing none, we are voting on Senate Joint Resolution 62. All those in favor say aye. Aye. Opposed? Ayes have it. Resolution goes on to calendar and rules.
Thank you, Mr. Chairman, committee.
All right, thank you. That brings us to item number 12, House Bill 859. Chairman Jernigan, you are recognized. You have motion and second.
Thank you, Chairman. Members,
And there is an amendment. Do you want to?
there is an amendment.
Okay,
yes.
let's, yeah, motion and second on 4763. Is that correct?
That is.
Okay.
This is all good news.
All right. Without objection, let's go ahead and vote on amendment 4763. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
You did throw me off my game. Members, House Bill 859 allows for the Department of Health to share de-identified data from EMS run reports for the purposes of overdose and responses. This sharing of information with sister agencies, with counties and local governments who want to participate will help us combat overdoses in real time, getting resources to first responders in hot spots and spikes across the state. We've been working with the Department of Health on this since October, and we've gotten to a great spot and stand ready to answer any questions.
Okay. Any question for House Bill for the sponsor? All right. Seeing none, we're voting on House Bill 859 as amended. All those in favor say aye. Opposed? Ayes have it. And bill goes on to calendar and rules. All right, that brings us to item number 13, House Bill 498 by Chairman Martin. You are recognized. You have a motion and second. And
That's it.
we don't need it up in there. Okay, you're recognized.
Yeah. Thank you, Chairman and committee. This bill is 498, has an amendment on it, 440, 44. If it already carrying with it?
It's rolling with it.
Perfect. Perfect. This is in regards to telehealth with physician assistant. Currently in Tennessee, every 30 days, there has to be a collaborating physician meet with the provider. So currently 10 out of the 12 of those have to be done, can be done virtually. The other 2 have to be in person. This would put all 12 being virtually. The reason for that is those practicing solely virtually don't have a physical location. So this would help in that regard. And the second aspect of this bill itself, currently to be seen telehealth, you've had to been seen at least one time in the last 16 months in person. This would provide an exception for behavioral health treatment where they could be seen virtually the first visit and the follow-up visit would then be in person. Again, this would help speed up the process of getting those mental health patients seen quicker and then the access of care and the direction of care that they need. I stand ready for questions.
All right. Do we have any questions for the sponsor of the bill? All right. Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. I just can't help but acknowledge the fact that you get a very hard time from your caucus chairman down there every time you come before a committee. And I just want to say, you know, if you want a nice caucus chairman, you're welcome to join us at any time when we need some folks. His jokes get old, so I'm just making that offer, put it out there. Thank you, Mr. Chairman.
Get old, they're aged. Chairman, you're recognized.
I would remind the caucus chair from the very minute party, they're not very kind because there's nobody in your party.
All right. We are back on the bill. The question's been called on the bill. We're voting on House Bill 498. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and Committee.
All right, thank you. Last two bills are mine, so I will be passing the gavel.
This brings us to item number 14 on the calendar, House Bill 0514. And Chairman Terry, you are recognized on House Bill 514. Do I have a motion and a second? Have a motion and a second, so it's properly before us. And are there amendments?
Amendment 4642.
And that's correct. That's what we show. Motion second on the amendment. We've got those without objection. We'll go ahead and put the amendment on. All those in favor of Amendment 4642 on House Bill 514 indicate by saying aye.
Aye.
All those opposed say nay. The ayes have it. So we are on House Bill 514 as amended. You can open up.
All right, thank you very much. And as many of the members know, we do have a cannabis commission, and it has 9 members. And what this simply states is to have one of the governor's appointments. Those are going to be due up this summer, and have one of those be a patient that has one of the qualifying conditions. And with that, I'm open to any questions.
Any questions for the sponsor? Dr. Kumar, Chairman Kumar, you're recognized.
Thank you. I would appeal to the chairman to also appoint somebody who has been affected by the adverse consequences of marijuana or have a family member who has suffered from them. Thank you, Mr. Chairman.
Thank you.
Chairman Terry, you're recognized if you want to respond.
That's not in this bill.
Chairman Clements, you are recognized.
Thank you, Mr. Chairman. I just also recommend that at least one of the appointees be a consumer. There might be one from Cott County down there. I just want to say that suggestion. Thank you.
Does anybody have a question on the bill here? Are we ready? Any other questions of the sponsor? Seeing none, without objection, we're voting on House Bill 514 as amended with Amendment 4642. All those in favor say aye.
Aye.
All those opposed, the ayes have it. And the bill will be moving on to criminal justice. Thank you.
Thank you, Chairman and Committee.
All right. This brings us to item number 15 on the calendar, House Bill 325. I have a motion and a second already, and Chairman Terry, you are recognized.
And thank you. Thank you. The amendment is 6206. That's the one that we're going with because that corrects the grammatical error and also has the Lieutenant Governor and the Speaker in there as well. So we're going to go with that one.
Okay, with no objection, we'll go ahead and vote to put Amendment 6206 onto House Bill 325. Any objection? Seeing none, all those in favor of putting Amendment 6206 on the bill indicate by saying aye. All those opposed, the ayes have it. And we are on the bill as amended.
All right, thank you. And what this does is, as many members know, we passed the 10 Together legislation several years ago. And some of the members of this committee, I believe, chairman of both parties were on that subcommittee and served on that as well when we fought for this years ago. And the sunset occurs this summer. And this past winter, the CDC came out with their guidelines, which actually was in line with what we did years ago. And so we're going to remove that sunset.
Question on the bill, and I think we're just going to go on with that. If there's no objection, then we will go ahead and vote on House Bill 325 as amended. All those in favor say aye.
Aye.
All those opposed say no. The ayes have it. And this bill will be moving on to calendar and rules. Thank you. And
All right. Seeing no other business before us, thank you for your attention. Oh, Chairman Vaughn, you're recognized.
Thank you, Mr. Chairman. As a point of personal privilege here, I'd like to say that I'd like to welcome Representative Jernigan's hair to this committee. I don't know if you have noticed the coiffure that is atop that man's noggin today. That thing, it should have its own website. It's one of the finest haircuts I've seen in a long time. So for someone who is follically challenged, I sit here in nothing but amazement. Look, that's just outstanding. And I think that accomplishments by Tennesseans should be recognized when we see them. Thank you.
All right. Thank you. Yeah. All right. We are adjourned.